Hi there, Dr. Louis here. And I've been having a lot of conversations with individuals this week about an integrative approach to mental wellness. And I was surprised to learn that a lot of people still think that addressing mental health related concerns is just therapy or just medication management or even just a combination of the two. But the truth is that the most effective way to address mental health related concerns is to take a comprehensive look at an individual's physical health, their mental health, their social health, and yes, even their spiritual health. And so in this video series, we're going to be looking at physical factors that can contribute to mental health related conditions. Specifically, we'll be looking at 3 hormonal disorders that your patients could be struggling with that are masquerading as mental health related concerns. You won't want to miss it. Stay tuned. So in this video, we're going to be talking about poor glycemic control and its impact on mood. And this is even if your patients have a normal hemoglobin A1c. But before we get too deeply into our video, I want to take a moment to introduce myself in case you don't already know me. So my name is Dr. Louis. I'm a licensed naturopathic doctor and also a board-certified psychiatric mental health nurse practitioner. I'm the author of Optimize Your Body, Heal Your Mind and Set on Edge. And these are 2 books where I share my integrative approach to mental wellness. But most importantly, to me, and I hope to this audience as well, I am a Seventh-day Adventist Christian who has studied Christ's method of healing and who wants to share what I've learned with other Seventh-day Adventist healthcare professionals so that we can truly integrate health and the gospel in order to meet the heart need of Christ and to help introduce people to the 3 angels' messages. Okay, so let's get into our video for today. Okay, so let's get started with poor glycemic control. And our key hormone here is insulin. Okay, so it's pretty much common knowledge that insulin plays an important role in regulating blood sugar. However, what is a lot less known is the fact that insulin also plays a critical role in mood regulation. Okay, and we're going to talk a little bit more about that as we continue. But just as a quick refresher, we're going to talk about the hemoglobin A1c, which is one of the most common tests to do to evaluate a person's glycemic control or how well their body is controlling their blood sugar. Okay, so for the hemoglobin A1c, the normal range is going to be under 5.7. So if a person's A1c is below 5.7, then we say that their A1c is within the normal range. Their body is doing what it's supposed to do, doing what we expect it to do, doing what it was created to do as far as controlling their blood sugar is concerned. Okay, so when we get to 5.7 to 6.4, then we enter into the pre-diabetes range. This is a range where if we don't do something, if we do nothing to change what's going on, the physiological processes that are taking place in this person's body, then they will eventually progress to diabetes. Okay, so 5.7 to 6.4 is the pre-diabetic range. Okay, above 6.4, that's when a person meets the criteria to be diagnosed with diabetes. Okay, so ideally, we want to see that A1c below 5.7. All right, so now let's talk a little bit more about how the role that insulin plays in mood regulation. Okay, I want to share this study with you. Okay, so the title of this study was Mood Changes Associated with Blood Glucose Fluctuations in Insulin-Dependent Diabetes Mellitus. All right, and I'm just going to read the part that I highlighted here for you. So it says low blood glucose levels tended to be associated with negative mood states, primarily self-reported nervousness. So here what we're seeing is that when individuals in this study when their blood sugar began to drop, they began to experience nervousness or like that anxious feeling. Okay, so we know that a hypoglycemic state, which is where your blood sugar gets too low, is associated with that feeling of anxiety. Okay, and then it goes on to say positive mood items were almost always associated with high blood glucose. High blood glucose levels also frequently correlated with negative mood states. So not only were there not only were the negative mood states, so things like nervousness, anxiety, related with low blood glucose, but there were also some negative mood states that were associated with higher blood glucose levels. Okay, and we'll see what those were shortly. Okay. Let's continue. So, high blood glucose levels also frequently correlated with negative mood states, although the negative mood items that tended to relate to high glucose, anger and sadness, differed from those that tended to relate to low blood glucose. So, we've already seen that the low blood glucose was correlated with anxiety or nervousness. And here we're seeing that the high blood sugar levels were correlated with feelings of anger and feelings of sadness or depression. Okay, so there is a correlation between blood sugar control on one hand and mood, anxiety, depression, mental health related symptoms. Okay, so this is what this study demonstrated. All right, and this was again in insulin dependent diabetes mellitus. Okay, but you might ask, well, what about my patients that don't have type 1 diabetes? So let's go on. This study is called Does Glycemic Variability Impact Mood and Quality of Life? And let's see what I've highlighted here. Let's read the conclusion. Okay, so it says data suggests that greater glycemic variability may be associated with lower quality of life and negative moods. So what is this saying? Here we're finding out that when you have these higher fluctuations in blood sugar, okay, then that is associated with a lower quality of life, and it's also associated with negative mood states, okay? This is what we're finding, okay? And again, these negative mood states can be things like depression, anxiety, other mental health related concerns, okay? Let's continue reading. It says implications include replication of the study in a larger sample for the assessment of blood glucose fluctuations as they impact mood and quality of life. So they're saying, hey, in this preliminary study, we have seen a correlation between negative mood states and fluctuations in blood sugar control. Okay, but we would like to see larger studies so that we can get a more thorough understanding of the correlation. That's essentially what that second line is saying. So we're seeing here that there is research that suggests that there is a significant correlation between not only just high blood sugar and low blood sugar, but also the fluctuations of blood sugar. So there are correlations with all of those different factors as far as blood sugar control is concerned. Those things correlate significantly with mental health concerns. Okay. All right. So here's another study. This one is called Insulin Resistance and Depression, a cross-sectional study, okay? And here it said, because in our study, higher depression scores were already prevalent in those with impaired glucose tolerance without clinically manifest diabetes, our findings might be explained biologically. That is, by pathophysiological changes behind insulin resistance and depression. Okay, did you get that? Let's kind of dissect this piece by piece. So it says, because in our study, higher depression scores were already prevalent in those with impaired mood tolerance. Okay, so because these individuals already had higher depression scores, even though they had not been diagnosed with diabetes, says our findings might be explained biologically. So there may be some kind of correlation between insulin resistance and depression. So this is insulin resistance is this is something that happens before someone meets the criteria to be diagnosed with diabetes. So we know that the way God created our bodies is such that our bodies will do everything that they can to compensate and compensate and compensate. They will tolerate our mistreatment. They will tolerate the junk food that we eat, the nights that we stay up all night. They will tolerate that thing and those things, and they will kind of compensate until our bodies can no longer compensate. And then we start seeing the shift in the A1c. And then we start seeing the other like diabetes related symptoms. However, before all of that happens, we are experiencing insulin resistance. our bodies are becoming resistant to the hormone insulin. And so this study is saying that there is a correlation, well, there appears to be a correlation in this study between insulin resistant without a diagnosis of diabetes, okay, and depression. So far, we have seen that in individuals who have type 1 diabetes, so those individuals with who are insulin dependent, in those individuals, we've seen that there's a correlation between certain mood states, negative mood states, and high blood sugar levels, and also certain other mood states and low blood sugar levels. We've also seen that there is a correlation between fluctuations in blood sugar. And so when it goes up really quickly, it spikes and then it comes back down. So we've seen that there's a correlation between those fluctuations and negative mood states. And we've also seen that there's a correlation between insulin resistance and negative mood states. And so what we find here is that it is critical. It's absolutely critical that when we're working with our patients or our clients, and if they're reporting depression or anything like that, we need to optimize their we need to take the time to evaluate, first of all, and then also optimize their glycemic control. Okay. And this is even if a cursory look of their lab values just reveals an A1C within the normal range. Because as we've seen in individuals who have who do not meet the criteria to be diagnosed with diabetes, we still see if there is insulin resistance, if there's any degree of insulin resistance, then there can be a correlation between negative mood states and that insulin resistant state. Okay. So let me try to say that in another way. Even if our patients' A1Cs are within the normal range, or even if your clients' A1Cs are within the normal range, you need to dig deeper and evaluate for any level, any degree of insulin resistance, because you can have a normal A1C but be insulin resistant, and that can be contributing to negative mood states. Okay, let's continue. So we're going to do a brief case study. This is a patient that I worked with, and I'm calling her Alicia. Okay, so Alicia was in her early 30s. She had primary concerns of anxiety about everything. That's what she told me, because I asked specifically, what is it that's making you anxious? And she said, everything. I have anxiety about everything. Okay, depressed mood and feelings of hopelessness. Okay. So those were the primary concerns. This is why Alicia came to see me. Alicia also was reporting symptoms of shortness of breath, chest tightening, fluctuations in subjective temperature. So she would feel cold and then she would feel hot and then she would feel cold, but the temperature in the ambient environment was actually consistent. Okay. And then she reported that she would feel like she's going to pass out. Okay. So these are the symptoms that she came to me reporting. All right. So what was she doing? Alicia was consuming a ketogenic diet. She was grazing throughout the day, so she wasn't eating distinct meals. She was kind of like snacking a little bit here, a little bit there, grazing throughout the day, not consuming regular balanced meals, and she was also juicing frequently, okay? Fruit and vegetable juices, all right? That's important to keep in mind. And finally, Alicia was also eating late at night, and she was going to bed late, okay? So that's kind of what was going on with Alicia. Okay, so what did I recommend for Alicia? I'll tell you all of my recommendations and then we'll address each one of those briefly, okay? So the first thing that I recommended for Alicia was that she add in more plant-based foods and complex carbohydrates to her diet. And this is specifically important for tryptophan, okay? And we'll talk a little bit more about that in a few. So I recommended that Alicia include protein and fiber with every meal. And this is specifically to prevent those spikes in blood sugar. I recommended that she eat 3 distinct meals per day, preferably at the same time each day, instead of grazing throughout the day and snacking. Okay. And then I also recommended that she finish her last meal by 6 p.m. if at all possible. Okay. So let's talk a little bit about tryptophan. I mentioned that we would go more deeply into tryptophan, so let's do that. Whole grains are important for serotonin production, okay? So you'll remember that I recommended that she increase her consumption of complex carbohydrates, so whole grains, okay? And this is because whole grain consumption is critical for tryptophan production, for serotonin production, actually. So tryptophan is an amino acid that is found in our bodies. Tryptophan is most plentiful in complex carbohydrates, okay? And they're not as plentiful in the meats. So the food that Alicia was eating previously, okay? So this is why we said, hey, we need you to consider eating more complex carbs so that you consume more tryptophan and your body's able to make serotonin. Now, why is tryptophan important? Let's continue reading and then I'll explain it. Okay, so carbohydrates cause the body to release more insulin, which promotes amino acid uptake and leaves tryptophan in the blood. Tryptophan can then cross the blood-brain barrier where it can be converted into serotonin, impacting mood. So what does this mean? Essentially what it means is that when you consume complex carbohydrates, okay, there's something that happens in your body. So it's important for you to know that the transporter that transports tryptophan also transports a lot of other amino acids that are more plentiful in the body, okay? So specifically, I mentioned that tryptophan is comparatively less, lower concentrations in meat than the other amino acids. This is especially the case in meat. But when you consume plant-based foods, tryptophan does not have to compete as much with the other amino acids to be transported into the brain. Now, why is that? This is because insulin is released when you consume plant-based foods, and the insulin causes some of the amino acids that tryptophan normally competes with to be taken up into the muscle cells. So I'm specifically talking about the branched chain amino acids, so leucine, isoleucine, and valine. So when you consume complex carbohydrates, the insulin causes those amino acids to be taken up into the muscles. And so because they're taken up into the muscle, tryptophan doesn't have to compete with them as much to be transported into the brain, where it will then be available for serotonin synthesis, okay? Because we have to get the tryptophan into the brain in order for the body to make serotonin that's going to impact our mood, okay? Yes, your body makes serotonin in your gut and everywhere else, but we have what's called a blood-brain barrier, okay? And so the tryptophan has to get into the brain so that the serotonin in the brain has the positive effects on our mood, okay? All right, so let's continue. Okay, so now let's talk a little bit more about why I recommended that Alicia have her last meal by 6 p.m. as much as possible, okay? So this is a study called Prolonged Nightly Fasting and Breast Cancer Risk, okay? And it says, logistic regression models indicate that each 3-hour increase in nighttime fasting duration was associated with roughly a 20% reduced odds of elevated hemoglobin A1c. Okay, so let's put some skin and muscle on this, okay? So let's say, hypothetically, that an individual wakes up in the middle of the night, or let's say they stay up until midnight, they have a midnight snack, and then they go to sleep. And then they have to wake up to get ready for work at 6 a.m., okay? So they slept for 6 hours, and they had a 6-hour fast, because when they woke up, they had breakfast, okay? So they slept for 6 hours, they had a 6-hour fast. Now, let's say compare that individual to someone who had their last meal at 9, okay? Let's say they had their last meal at 9 and then they woke up at 6. So that was an additional 3 hours. So that individual has a 20% less likelihood of having an elevated hemoglobin A1c. Now, with Alicia, I recommended that she have her last meal by 6 p.m. Okay, so that would give her a 40% less likelihood of having an elevated hemoglobin A1c. And what we really care about is the fact that it would lead to her having better and more optimal blood sugar control. So it is critical that we fast overnight. Ideally, the longer the better. We see that every additional 3 hours reduces your likelihood of being in the pre-diabetic or diabetic range of having an elevated A1C by 20%. So if we can ideally fast for 12 hours overnight, 12 to 14 hours, then, the odds of us, barring other things going on, the odds of us having um, suboptimal glycemic control become much more slim. Okay. However, on the other hand, if our patients are eating, like having midnight snacks and eating throughout the night, then it's much more likely that they're going to have fluctuating blood sugar levels and they're going to have correlated mood symptoms as a result. Okay. So this is why it's so important that we get our dietary habits and the actual things that we eat under control in order to address or help our clients and patients address their mental health. I want to take a brief pause here because I mentioned at the beginning that I had been talking with individuals about an integrative approach to mental wellness. If you've been following our channel for a while, then you know that I am planning on doing an in-depth, a more comprehensive training on mental wellness and helping individuals improve their physical and mental health, but specifically from the angle of improving mental health in order to help people live optimally and help spread the three angels messages and help people just experience peace. And I've shared in many videos on this channel that this is really the foundation of our work. This is the foundation of our health message. Historically, the Adventist Church and the Adventist health message has been one that focuses on mental well-being when other voices were silent. Okay. And so if you are interested in learning more about how to optimize mental health by looking at physical and physiological factors, kind of like what we've been describing so far, then I'm going to invite you to fill out the form that you'll see in the description box below this video. And I'll also place it in a comment and pin that comment. Fill out that form so that we can have a brief conversation and I'll keep you in the loop about the upcoming training. Okay. So, that's what my invitation to you is today. And let's continue on with our video. So I would be remiss if I did not share the outcome. So what happened with Alicia? This is what she stated after we had worked together for some time. So Alicia said, the last couple of months have been an incredible challenge. Anxiety, fear, fatigue, equilibrium completely off balance, couldn't sleep. Since then, I saw my naturopathic doctor at Focus Integrative, and after making a nutrition strategy and 0 medications, I can already tell a dramatic improvement. Okay, so this is the result that we can see with our patients and our clients when we just implement the things that God has already taught us. You know what I'm saying? Like the research is finally catching up to the things that God has told our church hundreds of years ago, and unfortunately, some of us are not really listening to what God has said and what he is saying, but God is looking for a people who will put into practice the things that he is teaching and has taught and share those things with others so that they can experience optimal living, optimal life, And so, yeah, this is our work. This is the work that he has entrusted to us. And I just want to invite you to take hold of this work as well. All right, so let's continue. Key takeaways from this. So our summary is that there are many things that we can do nutrition-wise to help our patients achieve optimal blood sugar control and, as a result, optimal mood regulation. Okay, so here's a recap of the points that we've covered. Number 1, balance. Okay, it is important for us to help our patients and clients by ensuring that their meals are well balanced. Okay, so they need to have protein, carbohydrates, and fats, okay, in order to not have these spikes in blood sugar that we've been talking about. Another key point is regularity, okay? It is critical that we encourage them to eat regular meals unless their health condition or medication dictates their meal times, okay? So instead of grazing throughout the day or snacking randomly, it is important for them to establish some sort of routine in as much as is possible where they eat at the same time every day, because that helps prevent these blood sugar spikes, these fluctuations in blood sugar that can then negatively impact mood. All right, distinct meals. Okay, we talked about that. We need to encourage them to eat distinct meals rather than grazing and snacking, again, because this helps prevent the fluctuations in mood. And then intermittent fasting is what it's termed, this overnight fast, okay? So we can educate them concerning the importance of fasting overnight for, as I mentioned, 12 to 14 hours by teaching them about how that will positively impact their blood sugar control and their hemoglobin A1c levels, okay? So those are our key takeaways from this case study. So this brings us to the close of our first video in this series, specifically on how poor glycemic control can cause mental health related symptoms. In the next video, we'll be talking about how suboptimal thyroid function can contribute to mental health related symptoms and can masquerade as a mental health concern. I'll see you in the next video.